It is officially 12:30. Okay. So we'd like to call the meeting of the Board of Health for the City of Nashua. And we have the three members, so we have a quorum. First order of business would be to approve the November 9th meeting minutes. Sorry, I can't speak too well today. So I'm looking for somebody to move that, please.
Me, I do, yes.
Yep. Chuck, move second. Stephanie, can you hear?
She's on mute.
Okay.
She has to take herself off mute.
Stephanie, I think you might be on mute.
She says she's trying.
Okay. I'll second. But that kind of puts us in a quagmire, so we can speak.
Not yet. So Stephanie, you were
Thank you.
off mute before. Can you speak now?
Yes, I second the motion to pass the minutes.
Thank you very much, Stephanie. Welcome. Those in favor?
Aye.
Okay, it's unanimous. I'm not sure where you'd like to put this, but under community health, there was a question in the minutes, and so I would consider that old business, but somebody asked a question, and it was answered that they would get back to us next meeting on that.
What was the question?
I can read the question. There have been efforts to increase lead screening, but in this report, there was an increase in the number of lead poisoning cases as compared to last year. There is a discrepancy in the numbers. There were 21 positive cases of lead in children, but 35 parent letters were sent, and only one property letter was sent. Answer, we will provide the answer to this question in the next meeting.
Okay, so was the question on the number of
Right.
property letters?
There was a discrepancy, I guess there was 21 positive cases, but 35 parent letters were sent out, but only one property letter. So there seems to be,
So they updated the numbers in the report. So I can give their report when it's time for the community
okay,
health.
I'm just bringing it up because it is a question, and now that we approve the minutes, it makes it old business. So I'm going
Okay.
to leave that to the end, is that okay?
Yeah, or I can just give you the number. They look like they updated it in their report. There were
Okay.
39 property letters sent.
39 property
Right.
letters. I think it was Stephanie who asked, is that satisfactory, Stephanie?
Yes, it is.
Thank you. Moving on. Our epidemiologist.
Lindsay's online.
Oh, okay. Sorry, Lindsay. Can you give your report, please?
Sure.
Thank you.
So I'm going to share my screen. Okay, can everyone see that, the Word document? Okay, great. So I'm going to cover COVID, and then I'll quickly cover flu, RSV, and then the new updated pediatric bivalent vaccines for COVID-19. So as of right now, for COVID-19 in New Hampshire, we've had a total of 363,672 cases, with 101 new cases reported as of yesterday. For hospitalizations, it's been pretty stable with 91 people in the hospital positive for COVID-19 and 72 being treated with antivirals. I apologize. Let me restate that. So there are 91 people that are positive today, and the previous day there were 72 people positive. So we did see quite a bit of a jump over the past 24-hour period. So just something to keep in mind, especially around the holidays, that we may see a bit of an increase in the number of people positive in the hospital for COVID-19. And then for patients being treated for COVID-19, we've had 26 being treated with antivirals. And for cumulative deaths in the state of New Hampshire, we've had 2,835. For Nashua statistics, we've had 25,987. And 7 new cases reported yesterday. As mentioned previously, over the past several months, this is obviously going to be an undercount. This is only tests that are being reported to the state, that are sent into the state for laboratory testing. We've had 177 cumulative deaths in Nashua. For Nashua hospitals, we have currently 13 people positive for COVID-19, and 5 of those are being treated with antiviral medications. For CDC community levels, this is a metric used where it is measuring the number of individuals that are positive within a given county, number of individuals using beds within a hospital over the past week, and number of individuals being admitted over the past week in a given county. As of right now, Hillsborough County is in the low community level, which means that people living in Hillsborough County should stay up to date on COVID-19 vaccines, and that they should get tested if they have symptoms. Obviously, people can still wear masks and take all the measures that they feel comfortable doing so to prevent getting COVID-19 and giving it to other people. So I did want to cover flu because, as we all know, respiratory illnesses are ramping up around the holidays. Right now, one of the challenges with flu is that it's not a reportable disease in the state of New Hampshire. So we have to go off of national reporting, and we can use some hospital and school data. So for national reporting, we've had 26 cases per 100,000. That's hospitalization rate nationally. And unfortunately, we have had 21 pediatric deaths this most recent season, and 7 of those were reported just in 1 week. For New Hampshire surveillance in general, we do not report flu. In other states they do, and this is one of the more challenging things when we were to compare with other states, or when we look at a map nationally. It's very hard to determine where New Hampshire is at flu-wise. One thing we can do is use hospital data. So when we look at the number of individuals that are being hospitalized for flu, so in Nashua, we currently have 12 people that are hospitalized for the flu in St. Joe's in southern New Hampshire. And one thing Nashua does pretty regularly for weekly reporting is we report flu cases. So Nashua Public Schools, we report flu A, flu B, and we just recently started reporting RSV. So I made a little graph of flu cases. So pretty slow at first, but really started ramping up, and especially after Thanksgiving. We had 71 cases reported last week, which was huge compared to, 1 or 2 cases, looks like at the end of October. These are all flu A. There are no flu B cases being reported right now. Any questions about flu before I move on to RSV?
Chuck?
Oh, thank you, Lindsay. So is this from the school nurses, or did they give you
Yes.
this information?
Yep.
And how did the nurses get a hold of that? From the parents?
Yes, so another thing to mention is this is probably an undercount. This is only
Right.
kids that are being tested for flu. So there's a lot of illnesses going around, so not all of these students are getting tested for flu and having their parents call in and saying, yes, my student is out because they have the flu.
Documented, or just saying they think they have it?
It would be documented, so,
Okay.
yeah.
Yep.
Yeah.
Thank you very much. Thanks.
Any other questions before I move on?
Lindsay, I have a question on, it looks like this flu season is kind of ramping up to be more moderate to severe. Do you know, is it because the flu vaccine isn't being sought out, or is it because the flu itself is missed in the stew of the flu vaccine itself?
So for my...
Lindsay,
Yes.
I don't want to scoop you. I would say a few things. One is, actually, this year, it appears that the flu vaccine, from what I have read, is very well matched.
Yes.
It may be better than it has been in some years. But there's no question that this is the worst flu season in 10 years already. And it's pretty early, relatively speaking. So it's a bad year. it's probably because people waned immunity when they were somewhat in isolation or were just exposed to minimal pods. So Lindsay, please, add to what I have to say and what you heard. And
Yes, so I was gonna say, from my understanding, this year's flu vaccine, it's a quadrivalent, it's very effective. For what we're seeing right now, it's mostly just due to lack of uptake. There's a lot of misconceptions around effectiveness because of COVID. Because people think you can still get sick with the COVID vaccine. There's a lot of, and there's a hesitation to get vaccinated in general, and we've seen this lack of uptake because of that. So there's that, and it's very difficult because this could have been avoided because it is a very effective vaccine.
Okay.
And I think I heard someone, but it's very hard to hear on Zoom. Was there another comment or question?
I do have a question.
Please go.
Sure.
Thank you. Is it possible to get data from the schools? They say a child is out 2 or more days in a week, and the parent says because they're sick. Can we get that kind of data relating to how many kids out because of illness due to either cold or the flu or flu-like symptoms?
So we don't really get data as far as like individual student, just because that would be kind of identifying, and there's a million reasons why a student could be out.
Right.
So
I'm saying numbers, like flu-like
Yeah.
symptoms, not
Yeah.
necessarily the individual. So if a child call out sick from school and he's out multiple days, we have a tick for that particular child without naming or anything like that, just that we know that that child is out because of illness. And they may have like 20 kids out that week, and it could be 20 flu-like symptoms for that particular school. And then you got a total of 10 schools with so many children out, and you have your data there, without saying it's actually the flu, but flu-like symptoms.
no, so we only try and track flu, and then recently we started tracking RSV, but we don't really track like just cold-like symptoms. Yeah, I mean, it'd be challenging to do,
Oh, okay.
especially right now where there's so many illnesses going around. But it is something to consider, especially with how much the absences have been increasing quite a bit recently.
And I have one follow-up question. Can we bring the vaccination back to the schools, or that's not possible? Back into the schools for parents that may want their children vaccinated now for the flu?
They'll have to go to the, just come to the clinic.
They-
We've already finished all the
I know, but
the
can you
schools.
bring it back into the schools? No? That's a done bit? Okay.
It's done, yeah.
It's done.
They do all, oh, sorry.
No, it's okay. It's okay. It's all right. It's discussion.
They set up a whole schedule for that. And so they probably would not redo that again because of, how much work is required with that. And so for the parents that missed that opportunity, they can definitely come to the clinics, on the regularly scheduled clinics on Tuesday or Fridays. Yeah.
Okay.
And then we do push that information out, regularly and strongly encourage that.
Any other questions? Seeing none, would you like to proceed with the report, or are you finished?
Okay. So I'll cover RSV very
Okay.
quickly, just because I know there's been some concern recently. So for RSV, we did see quite a bit of an increase at the beginning of fall. It was an early season for it. It's very common respiratory illness. It infects about 2/3 of every infant before the age of 1. So if you look at this graph, this is a national surveillance system for hospitalizations for RSV. There's a bright green hill right here at the beginning. This is for the most recent season, so 2022 to 2023. This is a very big increase and a very dramatic decrease for this season. Nationally, we've seen children getting very sick, so and I'll show what we've been seeing locally too in the schools. It looks like we're in a downward trend right now, so that's some good news. I know that there has been some concerns, and people have been reaching out to us about concerns about RSV. So it looks like we're in a downward trend, but definitely do some, or at least give some messaging and try and do the right thing and not pass around babies and wash surfaces. RSV is kind of an interesting infection because it's not a vaccine preventable disease just yet, and it's mostly just spread through close contact. It is not a reportable disease in New Hampshire, and nationally it's usually not reportable unless it's hospitalization related. So for New Hampshire, one way we could do this is by looking at schools. We just started asking the Nashville Public Schools to start reporting this. So as of late October, they started reporting, and as you can see, the week of the 22nd to the 29th, we started reporting. You saw this kind of a little bit of an increase up to 18 cases. And then as of last week, we were down to, I believe, about 2. So it's leveling off, and that's what we've been seeing in general nationally. That's not to say that this won't go away. RSV season does last, I believe, until March. So just something to consider. It's here, and especially where we're not, in general, practicing distancing and masking, things like that. All these respiratory illnesses are going to come back, and they're going to come back hard. So, and then lastly, I wanted to cover bivalent boosters. So last week on December 8th, the FDA amended the emergency authorization of the bivalent vaccinations for children 6 months to 5 years old. So it's a little bit confusing, the differentiation between Moderna and Pfizer. So Moderna is very straightforward, where children 6 months to 5 years old can receive the original monovalent primary series, so 2 doses, and then they can receive the single dose of the bivalent booster. For Pfizer, it's a little bit confusing. So Pfizer in general, it's a 3-dose primary series. If they have not started their 3-dose primary series, they can get 2 doses of the monovalent, and then the 3rd dose will be the bivalent. Or if they're in the process of getting their primary series, they can, and they've gotten the 2 monovalents, they can proceed and get the 3rd with the bivalent booster. I mean, not booster, but bivalent vaccine. As of right now, they're not offering the bivalent as a booster. So if children have received all 3 primary doses of the monovalent, they cannot get the bivalent after that. So there's not necessarily a booster for the children who have received the Pfizer vaccine. Are there any questions on that?
I don't see any. Stephanie?
No, I do not.
Thank
Very good, thank you.
Thank you. Thank you, Lindsay.
And that's all I have for my situational update. Thank you.
Thank you. Now I have on my schedule, Bobby.
Yes, sir, thank you.
Ready or-
Yes, so I will give the director's report and some highlights from community services. And so, Dr. Sturridge, you know, I always start off with just reading our mission just really quickly. Our mission is to promote, protect, and preserve the health and the well-being of the greater Nashville region through leadership and community collaboration. And our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. And we subscribe to the following values of integrity, leadership, adaptability, and respect. So as far as our operational update, the managers and I continue to lead our staff and, collaborate with our community partners to deliver the core functions of public health. During the month of November, and then I kind of like squeeze in some of the December stuff as much as we've covered so far. We do continue our weekly COVID testing. As was mentioned, the numbers are going up, and we have experienced continued reports of positive cases within our own staff and exposures, as well as we're experiencing staff absences due to other illnesses related to respiratory diseases. We are continuing to wear masks in our conference rooms and common areas. It's really asked of staff to do that. And we are following the masking requirements of the healthcare facilities as we continue to experience exposure in the building and in our community. Now, we did learn on a call that some of the health providers have started to relax their masking requirements to basically patient encounters, and Chuck, I believe that this was reported out from Dr. Thing as well. So patient encounters, they're still wearing masks, but they've relaxed masking in meeting spaces at different points in times within the staff themselves? No?
Not in the primary care, we haven't, no.
Oh, okay.
We have to have them all as soon as we enter the building.
Oh, okay, so they're still doing the building. So some of them reported out on a call. I do a executive leadership team call with some of the CEOs, and they just talked about some of the changes that they were making because one of the other providers wanted to know what was shifting with masking in the healthcare settings. And so,
In the conference room where we have our monthly meeting, you can take,
Right.
lunch, that's where the.
Yes,
the
yeah.
wax, but up on the floor when you're dealing with patients.
right, yeah, all patient encounters still masked, but if staff are meeting together, they don't have to, it's not required, but people still can. I would still encourage folks to wear masks, only again because of the exposure. We still continue with our weekly incident response team meetings and dissemination of information through our newsletter and our EPI updates, and we continue to participate in our bi-weekly joint calls with our medical providers for situational updates and to understand what's happening in the hospitals and how they're being affected and impacted by the triple threat. For right now, what it looks like is that, as you saw from Lindsay's report, we still look like we're in low. Across the country, the numbers are going up, and they are starting to make changes with mask requirements in other states, and they're asking people to wear masks indoors. That probably will not happen in the state of New Hampshire, but again, we want people to be educated and informed to make those decisions to protect their health and safety. And then I also have in here, I do the executive leadership meetings with our mental health and health organizations, again, to understand what's happening in their areas and share information from here. Let's see here. Oh. All right, financial update. So the Public Health Network Services contract has been amended to include some additional funding to our Public Health Emergency Preparedness Program and our Health Disparities Community Health Worker Program. It has been, additional funds have been added to these two particular programs. The state wanted to balance out the budget with the funds that they had remaining, and so the Public Health Emergency Preparedness Program has been increased to $206,606, and the Health Disparities has increased from $15,000 to $154,796. This does have to go through Governors and Council for approval, and then go through our Board of Aldermen for approval because of the increase in the amount of money that's provided here. Just some highlights from Community Services. Our behavioral health team continues to facilitate the Mayor's Substance Misuse Task Force, which we've changed the name from the Mayor's Opioid Task Force to include focusing on substance misuse for other drugs as well. There's still an emphasis on the opioid epidemic because we have started to see increases in overdoses, and there are some strategies in place to respond to that. They've been collaborating with Rivier University on a student matriculation project, so we want to find out as far as students that go through their behavioral health program, how many of them end up getting jobs and where they're working. So we want to kind of like find out to increase that workforce capacity. Narcan kits have been distributed based on overdose locations in our region, so in the greater Nashua region. In particular, they've gone to the libraries and they've gone to some businesses where overdoses have been reported. As far as communications, for the behavioral health team, we've had a focus on getting information and awareness out around mental health because of this season, because of the increase in overdoses as well, because of the winter, the longer days of darkness or less light, and with the holidays, there are more mental health issues that arise. And so we've been doing some podcast production. We have billboards that are out as well. For the podcast production, many of those have been translated into multiple languages, and we still have our radio presence, and we're doing our media promotion messaging as well. The epidemiologist already gave her situational update. Some of the other things, she continues to maintain that awareness and provides updates to our team internally as well as our partners. She did a presentation during November at our APH annual meeting, and also did that presentation for that executive leadership team last Friday. She also submitted an application. We worked on CDC Legal Epidemiology Learning Cohort Program, and this is to allow for our EPI to engage with a team that focuses on legal analysis of legislation, so that will help increase that skill set for us on our end internally. And then she's also the lead facilitator of our community health assessment planning process, which we are beginning this month. Our health disparities community health workers continue to do outreach in the community to connect community members to services. They continue to support the services that we provide internally at our clinic during outreach, and even have supported some environmental health food inspections. They participate in the podcast productions because they translate the information into the spoken languages of the community that they have the primary language in. And they're also supporting all of the other programs that we have at the division. Our FEP coordinator has been working on drafting standing operating procedures for getting us equipped for response at the division. Did a successful job at leading our CERT volunteers during the holiday stroll. We saw you over there, Gloria. Did you guys go to the holiday stroll? Oh, it was nice. So kudos to Pat for getting those guys involved. He's also received his Certified Health Education Specialist credentialing from the National Commission for Health Education Credentialing. So he's been busy getting all of his certifications under his belt early on. So congratulations to him for that. And he's continuing to participate in our statewide meetings for emergency response. Our public health network strategist coordinated our biannual FAC meeting that was held last month, again, which was very successful with the attendance of our FAC members, and our keynote that did a focus on storytelling and the importance of listening to the stories of community members when we're interacting with them and coming up with strategies for success. She's also, so we applied for a leadership opportunity through the National Leadership Academy for Public Health, and we were accepted into that program. So she's the public health lead for that with 3 other partners in our community from community development, our Nashua Regional Planning Commission, and Lamprey Healthcare. And their focus is going to be looking at tackling the problem with transportation. So we know we have a big transportation issue in the state. We also see that, and I've heard that from our from folks in the community and from some of these folks that work on these initiatives as well. So that's going to be a 10-month program, and we'll see what comes out of that, but we're really excited about that. She's also coordinated an advocacy training that we have with New Futures for our division-wide staff meeting last month, and that's in preparation for what we're expecting to happen during the legislative season to help us be better prepared to look at legislation, analyze legislation, and then be able to be responsive for that. So this training for our division-wide staff, what the epidemiologist is going to work on, is also going to help us increase with our advocacy, support to advocacy work. And then she continues to lead the migration work from Live Stories to My Sidewalk. Our Live Stories contract ends on December 31st, and so we've got to get all of our information that we have, our community health assessment plan, all that stuff that's on the website. When you go on, then you can click through has to now be changed to a new platform. So they've been working on that over the past several months. And we have to get that also taken care of, because in our accreditation submission, the links to some of the work that we've done is linked to this Live Stories page that's going to be gone after December 31st. So everything has to get uploaded to my site. And Jane and Lindsay and Mackenzie have been working on that. The Public Health Equity Officer gave a couple of bullets for, again, some highlights. So these are just a few bullets here. Their full reports are were sent out by FOCIA, so you could actually see more of what these folks have been doing. The Public Health Equity Officer is enrolled in a Diversity, Equity, and Inclusion Certificate Program at Cornell University, and she's completed 3 out of the 4 courses, and she should be finishing that up in the next couple of weeks. She's the lead facilitator of the Justice, Equity, Diversity, and Inclusion, or the JEDI work group. That's with the YMCA of Greater Nashua. And she coordinates efforts with our community health workers on some of the programs projects that they're working on. And she continues to participate in ongoing training. As far as staffing updates, we have several positions that are open right now. Public health nurse position, which Kim informed me that she will be doing some interviewing for that. We also posted an LPN or medical assistant position to help with some of the non-licensed at the RN level clinical work that could be done in the community health department. We also have our program assistant, health promotion, and a community health worker position open, and we've gotten several applications for those, and interviews have begun for those as well. So we're hoping that we can get some folks hired within the next several weeks. As far as staff development, and that we do to maintain our competency skills and in support of the workforce, we participated in that advocacy training session that was provided by New Futures, facilitated by or coordinated by Jane. We had several staff attend the American Public Health Association meeting last month. Environmental health staff, and Heidi will talk a little bit more about that, achieved some credentialing as well. So we had at least one person finish some two. We had 2, right? Finish some training, Tim and Mike, last month?
It was prior to that.
Oh, sorry, prior to that. And then we have some spring semester student placements that will be beginning for medical students in January, and some public health students as well. And then I just listed some of the boards and committee and commissions that I've attended during the month of November. And that's the report. Any questions?
Thank you, Donna. Any questions? Stephanie?
No, thank you. Good work.
Thank
Yeah.
you.
Chuck?
No, great work, amazing, thank you.
Thank you very much. Obviously busier than, I would say busy, but you're busier. Next on our community health development report, is that going to be by?
So I will, nope, I'll give that. And so we do have some staff, that are out. Lindsay actually did her report online because she's doing another meeting right afterwards. That's the reason why she wasn't here. But Kim's actually out. So I can briefly do the community health report. So you have it, and now the report is reported out so that you could see, compare last year to this month, this year, and then they have the total of activities around communicable disease surveillance, tuberculosis, what we're seeing in our STD, HIV, and hepatitis C clinics. Let's see here. I'm just looking to see if the numbers, so the numbers for communicable disease investigations increased during the month of November compared to the same time last year. And in total, they've investigated 65 diseases. We've had 6 outbreaks year to date, and we've only had 1 during the month of November, COVID outbreaks. And I know that they closed a couple out in some long-term care facilities last week. With regards to, so you can see the numbers for some of the outreach activities there. These numbers are not significantly higher. Same for the interactions of contacts with our syringe services. No significant changes there. With the immunizations, we did more during this month of November than we did last year around the same time. And we're at a total number of vaccines at 3,080 up up to this point. And then you had asked a question earlier in response to Dr. Stephanie Wolf Rosenblum's question with regards to the clarification on the letters, and they just made sure that they updated that as well. So on this report, there were just 2 new cases reported of confirmed venous over 5, with 12 capillaries, and they were able to send out 4 parent letters just in the month of November, and so the total for that has been 96, and the property letters, none for the month of November, but a total of 39. Okay, and let's see. Some highlights that she had on here. I just want to see if she had that Ebola on here, because that was something. Oh, I didn't have that on mine. I thought I had that on mine, but we actually did have. You read it? Yeah, I think it was in my report. I don't know if there's a page missing, but I did have something on here
No,
about.
I remember that they
Yeah,
isolated the person.
yeah. Oh, so I think,
That's
okay. Because that was very well done with the coordination and collaboration between Flavia and the state. Maybe I didn't. I thought I had that in there. Anyway, so that was something that was pretty significant. And so what we're going to do is we're going to follow up with an after-action report, and we're actually going to do a tabletop exercise as a result of that for more training between us and the state. But that was very well done. Let's see. And then there's several other bullets with some other highlights from each of the programs. We have 1 active TB case that's under management. We've been doing some Riviere sexual wellness clinics. That's held once per semester on campus with Riviere, which is great. With immunization highlights, I told the numbers already. Lead highlights, went over that already. And behavioral health highlights, we're continuing through community health with our behavioral health nurse and our behavioral health team. She's going to continue with ongoing performance management and quality improvements with our syringe services program. And the naloxone administration continues to make referrals for treatment and support services for individuals that have substance misuse disorder, and has worked with our behavioral health specialists in some of the community work with crisis collaboration and with the Mayor's Opioid Task Force. And we did have, it was introduced at one of our last meetings, our community health worker facilitating a fatherhood group at the Arlington Street Community Center, and that continues once a month, and one of those events was held in the month of November. So there's quite a few things highlighted on here, and if you have any questions, I will do my best to answer those.
Stephanie, do you have any questions? The only question I have is this. In the immunization highlights, the first bullet, I'm assuming it says 176 individuals were vaccinated in comparison to 1,114 individuals were vaccinated in October. This is an 84% decrease. I'm assuming that's flu vaccines. It doesn't highlight it.
So there was actually a decrease because we learned that the way that we were, or what we were doing as far as vaccinating individuals that came to seek services from us was in violation of the National Federal 317 law. So, so what it says is that if people have health insurance, they're not supposed to come to the public health department to get vaccinated. So we have this system, NHIIS, that if we vaccinate individuals that have 317, that don't meet the 317 criteria, it dings us. And so then we were provided with information that we could no longer provide those vaccines to those individuals. So we had to call a bunch of people and cancel. What I have done, though, however, because that's a big challenge for me, there was some pushback, and so I read through 317 myself and saw that there are stipulations in there that do allow for you to vaccinate, and because we're in flu season, you're supposed to be able to vaccinate. And so I was able to contact Congressman Custer's office. They provided an update from the CDC that does say we are allowed to provide vaccinations to anyone regardless of their status because we are in flu season, and provided that information to the state. And we also, with all of that was happening, Annie Custer's office was able to meet with Senator She's married to Clement Towers. Rosenwald, yes. And so what she did was, she's going to put forth some legislation to change some things and also to get more funding for us here in Nashville to expand the amount of vaccine that we can get under that 317. It was not good. We had to actually turn people away from our clinic that come here that have barriers to accessing the vaccine, and our staff was not comfortable with that. And so I had to take that up to the state level and all the way up to the Congress because it's a federal law.
So the follow-up to that would be, do we know of this 1,000-plus people, have they been vaccinated?
So,
Or are they frustrated and saying, no, I'm not going to?
so the 176 is the number that we did in November. In October, we did vaccinate this 1,100. That was the total for October. That also included the school vaccines and everything else. The reason why there's such a big decrease is because then we could no longer continue to vaccinate some of the people that we were vaccinating. They had to cancel those all out. Whether or not they got vaccinated elsewhere, that we do not know.
Okay.
And the reason why people come to our clinic is because there's barriers and challenges, right? You know, to accessing those services. And that was explained to our state health department, our immunization program, the director of Health and Human Services, as well as to our legislative leaders at the national level. So there has been some action and a positive response to that.
So we probably were not going to see that next year, that issue.
So that has to be taken up at the congressional level. My goal is for New Hampshire to make a allowance like we do with the kids to allow for us to vaccinate seniors over the age of 65, because it's just one of those things where they were trying to protect the 317 vaccine by saying if a client has insurance, they should be going to their doctor's office and not coming to public health.
Can we as public health bill their insurance?
We cannot.
We cannot?
We can only bill Medicare insurance. We can't bill other insurances.
We used to do that, though.
Only Medicare and Medicaid.
We used to do it in the old days, Bob. We did. Because remember, they weren't doing it, and we had these people that had insurance, and they said, oh, no, we never even asked. And then we as the board said, well, if you want these people to come in, because I think what we were doing at that time, and my memory is foggy a little bit on this, we were asking them to pay $1 or $5, whatever it was, what they could afford, type of thing.
We still do that.
Yeah, if somebody had insurance, then we would accept the insurance and fine. And we had done that way back when, this goes to ancient history.
Okay.
But maybe at some point they said, no, you can no longer do that. I'm not aware of that. But we're doing it for some
Yeah.
time. I don't know if we can revisit that or ask them to open that up.
It is something that we're looking at. There's a cost to it though, right? And so now with all of these different, with Epic and all of these different electronic medical
I think that
records.
was one of the problems. Now that
Yes.
you mention it, I think that was
Yes.
one of the problems.
Yeah.
Because when we were doing it, we had to pick up the phone, because back then we didn't have like data transfers. So we had to pick up the phone and submit the number and the
Yes.
person and all this other stuff. And I think somebody on the other line said, oh, we'll get back to you, but we're not going to get back to you place. It sounded like a physician's office said, okay, we'll have to reschedule next week for your insurance to let us
Yeah.
know. So I think that was one of the hang-ups, but it would be too bad. I mean, if you know, you have somebody, you can have a situation where one person may be coming in with insurance, maybe the child has the insurance, and the father or the mother doesn't. And it'd be great to vaccinate everybody.
Right.
Make it convenient,
Right.
and get it done.
They have to change the law though.
Yeah,
They would
I
have to
understand. I
change that,
understand.
yeah. And then
It's frustrating.
in order for us to take other insurance and the electronic medical record system that we have set up, we have to have the funds to be able to cover, because there's a charge for that. So every interaction that you do with insurance, and this is why it's so expensive with all of these nice little Epic and all that, because you charge for every different thing that you do, so. But there was some positive thing that came out of that, so there will be a public hearing on this 317 change for New Hampshire, and they are asking that we, speak on behalf of that, and we've got some good stories of how we've actually had to turn seniors away. We had a couple that was in their 90s come to get vaccinated that we had to turn away because they had Medicare insurance, and 317 says you can't vaccinate them. Yeah, there's special stipulations. If we have a campaign, or if we say we're doing a public health emergency drill, then we can provide vaccine.
Or we have a year-long campaign.
Hey, you think like I think. So, but there's some positive things that
If you need a
come out
letter
of
from the
that.
board to
We
support
definitely, yes.
the people,
When we do the public hearing, yeah, and so it's really good that our,
because Chuck's a really good writer.
yes, so are you. So it's really good that the folks that we have are so responsive to public health that they got right on it. Senator, Congresswoman Custer's office got right on it, and then once it got to our senator here, she was right on
It's
it.
coming up shortly, or?
She said she would send a date,
Okay,
and, yeah, and her expectation is that we would be there.
well,
We rose the issue.
good, okay, well, we'll get the letter. I mean, Chuck's getting older now, so he has more time to write it. So we'll get on. I'd rather have a nice letter presented than rush letter.
Yes,
Okay?
yeah.
And give you a chance to look at it and correct our imperfections.
Yeah.
and so forth. Okay? Thank you very much. Any other questions? Stephanie? I hope she didn't get disconnected.
No, I'm all set, thank you.
Okay, thanks, Steph. Next would be Public Health Emergency Preparedness Coordinator. That's Patrick, right?
No, so that was in the overview and the highlights, so Public Health and Community Services is all set. So next should be either environmental health or welfare.
Okay. But Patrick is still prepared.
Yes,
I promised to go congratulate him because he got his master's.
yes. He got his master's, he got his certification in public health, and then he got his certification as a
Well, maybe he won't want to shake my hand now. Let's do food.
Awesome.
Heidi, you're up. Good hungry.
Heidi P. Kokoka, Nashua Health Officer, giving the report for the previous month of November 2020 and 2022, I'm sorry. I see numbers and I misstate them all the time, so I'm going to avoid numbers. We're seeing it's all pretty good, but we're seeing our failure rate creep up a little bit too. And I would say that it's the post-COVID economy and staffing that is just prevalent out there, and we're seeing a lot of people who have just started in food service, so they're making some mistakes that they haven't been trained not to make.
It's
And
tough out there.
so we're delivering real-time education to the best of our ability, and when it comes to, we are issuing tickets, but the tickets are not, they're more for things that are directly relatable to food hazards, if you will, like temperature control abuses or not washing hands or something along those lines. So we talk about that internally a lot, but yeah, a little nervous about what the staffing looks like out there just generally, and we're hearing that with other businesses that we encounter as well. And I'm very grateful that we do not have an opening right now, because we struggled last time we hired an environmental health specialist. And yeah, I'm just thrilled that we have some interviews set up for other positions within the division. We are receiving complaints regarding rodents, cockroaches, and bed bugs. And this has been a pretty bad year thus far for rodents, and we know that bed bugs are here, and we also know that cockroaches are coming back as well. And we've had some staff work very hard with shared food service operations to have facilities maintenance, plug holes, and exclude pests from the buildings. And that's a little different than what we normally do, but we were glad that this particular piece of property, the property owners were very receptive to that. Nothing with pools. It's been quiet for most other things. It's interesting watching with the new fees what our revenue is creeping up to. I think people do appreciate the lowered reinspection fee. We're not getting a lot of complaints about the increases in fees as we were at the onset, but I do appreciate the outlook of making our program as sustainable as possible. And let's see. It was just this month, but Bobby, I think what you were thinking of as far as credentials is Ren just passed his CPFS, Certified Food Protection something. And so that was for this month, but he's remained very busy with a lot of things. And I will just see, we were very busy with Holiday Stroll as well. Ren and April inspected that night, and it went pretty well.
Mhm.
And we were really glad that it went as smoothly as it did, because that was a lot of people.
It's good. Get back.
And let's see. Ren did a federal indoor air quality discussion, and then the rabies review meeting, those will actually be, I'm excited that DHHS will be holding these ideally quarterly, so that we can really buckle down and kind of share some information on the rabies response across the state and really boost those efforts. I think Nashua is really ahead of a lot of the smaller towns, certainly, but I think that we do a really solid job when it comes to rabies control, when it comes to the reporting of exposures to animals. And Bob will probably talk about it a little bit more, but I've been participating in the encampment meetings, and that's about it for our report.
Thank you, Heidi. Any questions, Stephanie? I'll take that as no.
No, thank you so much.
Thank you.
Bob?
Good afternoon.
Pulling up the
Yes.
most important.
Thank you, Bob Mack, Welfare Officer for the City of Nashua. Just reporting on the Welfare Department for the month of November. You can see in the report our numbers as far as expenditures, pretty significant increase compared to last year at this time for shelter costs. That can basically be attributed to the fact that last year at this time, the Emergency Rental Assistance Program, or ERAP, was in full swing. The eviction moratorium had ended in like August of '21, but this emergency funding was very ramped up at that time, and so a lot of households were getting that assistance. At this point, this past November, a lot of those households had exhausted their benefits and funding sources through that program. So what we were seeing is a lot more folks coming in to request rental assistance. While there has been some additional funding put into the ERAP for the state of New Hampshire for the next few months, the focus of that funding is going to be on sustaining households in motels, households that are actually homeless, but that have been staying in motels for that extended period of time. So while some of the households that rent apartments may still get some assistance, that number is winding down. So we're seeing an increase with that population. So we continue working with our partner organizations that also have eviction prevention programs, and in many cases we will cover a month assistance, and then we'll refer them to one of these other agencies like the Front Door, Corpus Christi, Nashua Soup Kitchen, Salvation Army, what have you, to make up any gaps in that need. And we'll continue to do that. Our numbers as far as contacts, we've had a slight increase in the numbers of actual interviews, but the percentage of those who qualify for assistance is about the same as it was last year at this time. While the number of vouchers hasn't increased significantly, the cost related to those vouchers has. As I mentioned, I believe last month, that 18% increase in rental costs for the community is very significant. So, as well as the increase in costs for other costs of living, food and gasoline and utilities, et cetera. We continue working with the crisis assessment and referral process and our outreach teams that try to engage homeless that are in our community. As Heidi had mentioned, the encampment meetings, we've been holding those and meeting with DPW, Nashua Police, Public Health, the outreach teams, shelter program, and trying to address those as issues arise in those encampments. Engaging people to try to connect them to mainstream resources. It's not always as easy as it sounds. For various reasons, people don't want to take advantage of shelter programs, or some shelter programs are at capacity, so it makes it additionally challenging. I believe I had mentioned before that the Soup Kitchen was opening the winter overflow shelter, which they have done starting for this month, so it's not directly relevant to November, but it is relevant moving forward. They started taking, Michael Reinke had reported anywhere from 15 to 20 individuals each night over the past week since they've opened the winter overflow. So they'll continue to provide that service with the funding that came down from the state. It's for the county. We're basically seeing those Nashua proper cases. Some of the money went to Manchester, where another program, the 1269 Cafe, is operating their warming stations up in that part of the county. Let's see, it was mentioned some of the vacancies in the division. We will have a vacancy for a welfare specialist position. Joanne Perez is moving on to another position and will be leaving at the end of December. So we've started the advertising and interviewing process for that position. We continue to refer people to the mainstream fuel assistance program that's offered through Southern New Hampshire Services, CAP agency. This is for people that may qualify for assistance with heating fuel. And so we work in conjunction with that program to get people connected as needed. And right now, we've spent about 38% of our general assistance budget. So that's through the month of November. So I think it will be a little tighter than it was last year, but we'll keep monitoring it, and we'll do what we need to do in accordance with the state statute. I don't know if there are any questions.
Thank you, Bob. Pretty challenging. Any questions? You're good? Stephanie,
No,
you okay?
no questions. No questions, but just impressive how broad a net and how much networking goes into trying to ensure housing.
Yeah. And can I just add, because I know that when we do our reports, they're retrospective, right? So we're meeting in December to talk about November. But there have been some things that we've been working on this month that are concerning, even with some of the calls that we've gotten with regards to our elderly population. And there is one committee meeting that Bob participates on that we lead through the continuum of care that's focused on healthcare, with working with our healthcare agencies, the hospitals, with regards to some of the seniors that, when they're released from the hospital, if they don't have housing to go to, that creates a little bit of problem for our shelters. But we're also learning about, folks that are even in these hotels that need more support than what they're receiving. And so at some point in time, I mean, there needs to be some discussion on how we can do better with the senior population, because just from the few complaints that we've gotten about, one call that I received, someone said, we're totally forgetting about our seniors, because they're not rising high enough on the radar for people to focus on them unless they get to a crisis state, which is, we're working on a couple of cases, without saying, because one is too identifying, but we are working on some cases that are pretty interesting and complex, and I just, yeah.
Yes.
Yeah, with hotel placement, because they're sheltered, so they're deemed safe, but they're not, their care is not appropriate because they're in a hotel, and so they're not getting the services that they need in a hotel.
And if I may, many of these individuals they wouldn't qualify for a shelter program. They're
can't.
not at a level where they can care for themselves, but yet they're in a motel situation where it's not much better. And so it's just, as Director Bagley says, trying to coordinate those services so they can sustain in those motel placements. Many of these elderly folks have limited income, fixed resources, and so we may be required to supplement that and keep them in that motel until some alternative housing can be found. So it's a rising issue, an increasing issue that's being seen in the homeless
Yeah.
population in particular.
Not an isolated case.
No.
No.
And there are actually laws that we have in place that are prohibiting us from doing things with folks, because the laws say we can't do certain things. Some of these folks actually have insurance, and their insurance is denying payment for them to be in either long-term care facilities or in facilities where they can be cared for, or denying services that they're receiving for the hospital. And I just think that some of those things are just going to get worse, because I heard about 3 in the past week, and I'm quite sure there's more than just those.
Yeah, and as Director Bagley mentioned, the healthcare coordination meeting that we have with the hospital, shelter providers, and some other providers in the community, we're trying to coordinate those discharges. A lot of these patients are staying longer than they need to in the hospital settings because there's no safe place for them to go to. So I think the hospitals are doing the best they can, and it's a perfect storm, so to speak, of when this is hitting
Rise to a
ahead.
public health issue,
So,
right?
Yeah.
Stephanie, any questions?
I have a question.
Yes, ma'am.
Well, I have maybe a statement. Those who receive Medicare and Medicaid seem to have a better stay at it than those who just receive Medicare but can't get Medicaid because they're not poor enough, seem to fall through the cracks.
Yeah,
So-
I couldn't say that's not an issue. We were actually just, Director Bagley and myself were just at a meeting with Senator Shaheen, and they were talking about healthcare navigators and helping people navigate access to health insurance, whether it be Medicaid or some other insurance through the marketplace. But I think it's a valid point that some insurances don't cover certain programs. And if people qualify for Medicaid, they should be signing up for Medicaid.
They don't qualify for Medicaid, they're
Right.
on Medicare. And what
Right.
happened is, because they don't get both, they're paying huge medical costs from our services and stuff like that. So, but if they can qualify for Medicaid, that would be a different story. But because they don't, their co-pay fees are outrageous, and then they fall into not
Yeah.
being able to care for themselves.
And folks could contact 211 or Service Link to see if they may qualify for some other supplemental insurance. But you're right, I think Medicare covers only so much, and it
Right,
does
right.
leave folks with extensive medical bills.
Thank you. I'd like now to open for public comments. Don't see anybody there. Seeing that, before we adjourn, Stephanie, are you still there?
In a minute. I'm sorry.
Yeah.
It's a side
She must
conversation.
not know that she's been on mute.
Stephanie? Stephanie, can you hear me?
Yes,
Ah.
sorry.
No, that's okay. I have one piece of interest on my desk here that you had requested on the plant proposal for Temple Street. Do you want to talk about that, or was that just for informational only? This is the asphalt plant.
Oh, the asphalt plant. Yeah, I had asked Bobby about it because a constituent had asked whether the Board of Health had taken up the issue of the potential health risks of having it in a residential area, and Ren has done quite a bit of work on it. And perhaps when he is at the meeting, he could elaborate.
Okay. Can I table it to the next meeting?
Yes,
Okay.
from my perspective, yes.
Yeah, and I'll inform Ren if he could present in January. Sounds good?
Sounds excellent. Thank you so much.
No problem. With that, I'd look for a motion to adjourn.
Yes.
I have one.
So moved.
Two, we are adjourned. I would like to use the privilege of the chair. The next meeting, by the way, will be January 11th for your PDAs. I want to wish everybody great holidays, peace,
And to you.
happiness, and for some of us, safe travels, that we are going slow to see our relatives, and let's hope next year is a better year. And with that,
Amen.
Amen.
hopefully
Thank
everybody's
you.
been good, or in some cases, maybe bad, but whatever.
Thanks a lot.
Whatever gets you the present, right?
Take care.